Unnecessary government regulation is an obstacle to developing innovation healthcare technology. This is technology that will not only, I'm sorry, I'm supposed to recognize myself for 5 minutes. I'm yielding to myself for 5 minutes. Unnecessary government regulation is an obstacle to developing innovation, healthcare technology, something that I worked in for almost 22 years. This is technology that will, if left alone, will lower costs but improve patient outcomes and save lives. But bureaucrats often step in the way, just like the Biden administration did when they attempted to force a one-size-fits-all approach to the healthcare sector while failing to consider what's happening at the local level. While I served in the Missouri legislature, I introduced a plan that was called the Healthcare Compact, trying to wrestle that one-size-fits-all authority back to the states. And I'm pleased today that I have another fellow Missourian who is thinking outside of the box, Mr. Worley, on how to address the healthcare costs for patients. Mr. Worley, what have you found to be the greatest obstacle in your business to develop this new kind of way in which people can pay?
Every single day, we're motivated by one single goal, and that's to help people better access and afford care. We employ a team of incredibly talented people to make the unsure, uncertain moment that facing Americans all across the country something of the past. And so we want to give people the confidence, the ability, and the dignity to easily and effortlessly access and pay for care. I think our biggest barrier to that is just the inertia of the status quo, and moving that uphill requires the best efforts from all of us.
Would you say that the status quo is propped up by the regulations that this town has created that really kind of that stop innovation like yourself, like what your company has provided?
I think the degrees, to the extent that we can, the best regulation is probably no regulator. The ability for us to innovate and have degrees of freedom to respond to the market and respond to the customers and partners that we serve, that's what we're attuned to.
And how would you say that your business under the previous administration, now that you've had 10 months under this administration, have you recognized any kind of change?
2025 has been a transformational watershed year in that we have enabled nearly 20 million people to more easily access and afford care. We're providing people the peace of mind and certainty, and ensuring that unsure, uncertain moment that they're standing in a pharmacy is something of the past. We're giving them the ability to take care of themselves and their loved ones, and that is with the launch of the bipartisan Medicare Prescription Payment Plan.
Thank you. Mr. Jacobs, how has the Affordable Care Act caused healthcare to actually be unaffordable?
Thank you, Mr. Chairman. It's really encouraged consolidation within the healthcare sector. I talked in both my prepared testimony and my written comments about how the medical loss ratio encourages consolidations, that we essentially have healthcare oligopolies now, that it encouraged insurers to buy pharmaceutical benefit managers and other forms of businesses where they could offload and shift their profits.
Vertical integration.
Correct.
It's forced vertical integration.
And there's also vertical integration within the hospital sector. Mr. Poli's statement noted the significant amount of hospital mergers that have taken place over the years, and I believe said that 40% of those occurred between 2010 and 2015. Well, there was a law Congress passed in 2010. It's called Obamacare. And to say that did not have an impact, I think it very clearly did have an impact, whether it's accountable care organizations, that entities wanted to purchase physician practices, they wanted to purchase each other to get additional market clout, to negotiate more power, to negotiate with the insurers across the table from them.
Yeah. Mr. Obermeyer, you addressed that in order to move forward, you need access to data. One of the previous bills that was passed before Obamacare was passed was actually to create these health information exchanges. But in my opinion, having worked in that space, it's been an abysmal failure. It does not work. It does not benefit patients. The data doesn't go from doctor to doctor. And then to hear that you say that it's not even accessible for research, anonymized, this is something that we have to get our hands on, particularly if AI is going to be moving forward. And I worry about where we are with that. How do we address that by in a way in which we can still properly secure somebody's health information?
We're used to thinking about a trade-off between how easy it is to access the data and how safe it is. I think that trade-off is largely a product of using old technology and old data management systems. The most sensitive data in the world are kept on modern systems that let people access it when they need it and keep out others. I think paired with a strict approach to law enforcement, we can have the best of both worlds.